Hello everyone, this is Dr. Saurabh Sahi and welcome back to my channel Doctor's Storyboard. So let's start our DHA Gp notes, the extracted version of Master the Board. Continue with DHA Gp notes part 2. Budesonide is a steroid specific for IBD. First pass effect is good for IBD treatment. Short bowel syndrome has lacking of vitamin A, vitamin D, vitamin E, vitamin K, vitamin B12, calcium, magnesium, iron and zinc. Teduglutide is a GLP agonist. In SIBO, small intestinal bacterial growth, there is loss of ileocecal valve due to which bacteria is lodged into a small bowel. And the features are flatulence, bloating, diarrhea, steatorrhea, and the treatment is rifaximin. Microscopic colitis is a cause of chronic non-bloody watery diarrhea. Non-vegetarians, those persons who eat meat, they develops diverticulosis and they complains lower quadrant abdominal pain, that is pain in lower abdominal quadrant. You know that there are 4 quadrants and the pain is presented in lower quadrant, and they also complain of constipation, fever, bleeding, and in blood they demonstrate leukocytosis plus palpable mass, and sometimes infection also can be seen. The accurate test for diverticulosis is colonoscopy, and we use brand xylem methylene cellulose. While performing accurate test, that is colonoscopy, increase in dietary fiber are used to decrease the rate of progression and complication. But it is dangerous because of increased risk of perforation, infection, weakness of colonic wall. The treatment of diverticulosis is ciprofloxacin plus metronidazole or amoxiclav, ticarcillin, clavulinate or tazobactam or piperacillin. Ertapenem also can be used. Surgery can be done in case of perforation, fistula, abscess, stricture or obstructions. Colon cancer screening. It is important that patients do colonoscopy every 10 years beginning at the age of 50. Familial adenomatous polyposis screening. Screening with sigmoidoscopy at the age of 12 every year. Screening of Peutz-Jeghers syndrome, and it is done at 8 years age. Juvenile polyposis screening, and it is done at 12 years of age. Peutz-Jeghers syndrome characterized by multiple hamartomous polyps in association with melanotic spots on the lips and skin. Increased frequency of breast cancer, increased gonadal and pancreatic cancer. Gardner syndrome is colon cancer associated with osteoma, desmoid tumor and other soft tissue tumor. Charcot syndrome is colon cancer associated with CNS malignancy. Juvenile polyposis is colon cancer and is associated with multiple hamartomous polyp. Another key points from the extracted version of Master the Board: always stop warfarin before 3 to 5 days of colonoscopy. Now we come to pancreatitis. So acute pancreatitis. The causes of acute pancreatitis: hypertriglyceridemia, hypercalcemia, infection, drug toxicity, drug allergy, ductal obstruction, ERCP, cystic fibrosis, scorpion sting. There are many other causes. If you want to look through acute pancreatitis in detail, you have to see other books. Pancreatitis features: pain, fever, vomiting, and in severe case there is hypotension and fever. Best diagnostic test: amylase and lipase. Most specific test is CT scan in case of pancreatitis. More than 30% of necrosis in pancreas on CT or MRI. If it is revealed like that, give imipenem, meropenem. The laboratory test, complete blood count that shows leukocytosis and drop in hematocrit. There is also elevation in LDH and AST. We also can see hypoxia and hypokalemia and elevated urinary trypsinogen activation peptide. CT and MRI scan is the best imaging. MRCP is useful in finding etiology of the disease. ERCP is for therapy. Abdominal CT scan is always performed with IV and oral contrast to better define and outline abdominal structures. Treatment: NPO, that is nil per oral, intravenous hydration at higher volume, analgesics, PPI, decrease pancreatic stimulation from acid entering the duodenum. Necrotic pancreas need biopsy to rule out infection. Infected necrotic pancreas should be resected to prevent from ARDS, that is acute respiratory distress syndrome, and death. Pseudocysts are drained with needle. Please remember, pseudocyst which is in association with pancreatitis is an important question which will be coming in DHA exam as well. Enlarged sausage-shaped pancreas is seen in IgG4 related pancreatitis, that is immunoglobulin related, and absence of alcohol intake or stones is associated with it. The treatments are steroids but no surgery. Painless jaundice, weight loss, non-tender epigastric area, normal amylase and lipase, increased bilirubin, alkaline phosphate and GGTP. If these features are there, I will repeat it again. Painless jaundice, weight loss, non-tender epigastric area, normal amylase and lipase, but increased bilirubin, alkaline phosphatase and GGTP will show the diagnosis of pancreatic cancer. Depression plus weight loss, jaundice also signifies pancreatic cancer. If CT is negative, then endoscopy USG with pancreatic lesion biopsy is demanded. If CT shows lesion, then surgical biopsy has to be done, and it has to be done at the same time when the CT shows lesion. And the treatment for pancreatic cancer is chemotherapy plus radiation. The prognosis of pancreatic cancer is 5 years. Sometimes they might ask the prognosis of the disease as well. Mucinous cystadenoma and intraductal mucinous neoplasms are associated with elevated CEA and CA19-9. These are the marker of mucinous cystadenoma and intraductal mucinous neoplasm. Now comes with CLD, chronic liver disease. All forms of chronic liver disease produce ascites, coagulopathy, asterixis and encephalopathy, hypoalbuminemia and edema, spider angiomata and palmar erythema, portal hypertension leading to varices, thrombocytopenia from splenic sequestration, renal insufficiency, hepatorenal syndrome and hepatopulmonary syndrome is also associated with CLD. Cirrhotic patient should do ultrasound every after 6 months. The full form for SAAG is serum ascites albumin gradient. Serum ascites albumin gradient correlating level with specific disease. If SAAG is above 1.1 is highly suggestive of portal hypertension. If less than 1.1 gram per deciliter, then it suggests infection, cancer, nephrotic syndrome. If it is greater than 1.1 gram per deciliter, then it always suggests portal hypertension, CHF, that is heart failure, congestive heart failure, hepatic vein thrombosis, constructive pericarditis. So this SAAG ratio is very important. Spontaneous bacterial peritonitis is infection without a perforation of the bowel, where neutrophils are more than 250. All variceal bleeding with ascites need spontaneous bacterial peritonitis prophylaxis. The treatment of specific features of cirrhosis: if there is ascites and edema, we need to provide spironolactone and other diuretics. And when there is coagulopathy and thrombocytopenia, we give FFP, that is fresh frozen plasma, platelets only if bleeding occurs. In case of encephalopathy, we give lactulose and rifaximin. There is no specific treatment for hypoalbuminemia and spider angiomata and palmar erythema. When there is varices, we use propranolol and banding through endoscopic method. And when there is hepatorenal syndrome, we use octreotide and midodorine. This is the end of today's lecture. I hope you like it. And if you are the first time viewer of my channel, please like, share and subscribe and wait till another videos.